Welcome to today's webinar. This is the new provider, new biller for pharmacies, and this will be a general overview of the Medicaid program related to pharmacies. We will be going through some general information and about the transition. We also will talk about the different partners and players that are involved in the Medicaid program. That will assist you with knowing who you need to contact when you have a question related to certain information. We will talk about eligibility and how to check a client's eligibility. We'll talk about submitting claims to Medicaid for pharmacy, and then some other reference guides, how to keep up to date with changes in program and other tools that you may be using throughout your time with performing straight Medicaid claims. So we want to go over some general information with you first. Obviously, many of you have heard that effective April 1st of this year, Medicaid members enrolled in managed care plans will be taken out of the managed care plan when it comes to the pharmacy benefit. That pharmacy benefit will be coming out of managed care for mainstream plans, HARP plans, and SNP plans, or HIV special needs plans. This transition does not affect those patients that are enrolled in managed long-term care, PACE plans, MAP plans, Child Health Plus plans, or the Essential plans. So it's going to be important that you determine what eligibility that patient has, and so that you know where you're going to be billing your claim. This transition from pharmacy out of managed care will not alter or change the scope of the existing pharmacy benefits. So that means there will still be copayments, covered drugs and over-the-counter drugs, pharmacist-administered vaccines, enteral nutrition, and medical surgical supplies. So some of the medical and surgical supplies will also be carved out of managed care, and we'll give you some information about that. This transition period between April 1st of this year and June 30th, members will still be able to obtain a one-time fill for medications that are non-preferred without the normal PA requirement. This will allow prescribers and dispensers time to switch that patient over to a preferred medication, one that maybe no PA would be required, or to obtain a PA for that non-preferred medication if it will still be needed. So remember that for 2 to 3 months, that transition, providers will, or patients will still be able to obtain a one-time fill medication for their non-preferred drug. We want to also review with you some of the pharmacy programs that will apply as of April 1st. So we want to remind you about the preferred drug program. This promotes the use of less expensive, effective prescription drugs when medically appropriate. And you can find information about the preferred drug program on the Magellan webpage. And you can again get to that through the emendi.org website. Also, the link for that information is found on your screen. Also, we have the brand less than generic. So there are times that maybe the brand name drug is less expensive than the generic. So again, this program promotes the use of certain multi-source brand name drugs when that cost of the brand name drug is less expensive than the generic. That could occur, and so this program looks at those situations as well. The clinical drug review program is aimed to ensure that specific drugs are used in a medically appropriate manner. You'll also hear the term drug utilization review program and that helps to ensure that prescriptions for outpatient drugs are appropriate, medically necessary, and not likely to result in adverse medical consequences. So a lot of information about these different programs is available online. We also have a mandatory generic drug program, which requires a PA for brand name prescription drugs with an A-rated generic equivalent. Also, a couple more programs are the dose optimization program, which can reduce prescription costs by reducing the number of pills a patient needs to take each day. And also the preferred diabetic supply program. Again, information about this is available on the Magellan website. This provides members access to quality glucose meters and test strips, while at the same time reducing overall program costs. Information about a lot of these programs can be found online at the Magellan website or through emedney.org or the Department of Health pharmacy pages. So we want to go over and review with you the different players, the different partners involved in Medicaid so that you know who you may need to contact for certain situations. We're going to talk about the different partners, such as the Department of Health and their pharmacy unit. We're going to talk about OMIG, GDIT, or EMedney, the County Department of Social Services, and the New York State of Health. We'll talk about Magellan, the managed care plans, and you as the provider, some of your roles and responsibilities as a provider. So the Department of Health oversees the overall entire Medicaid program. They determine the Medicaid policy and what procedure codes are going to be reimbursed. There may be times that documentation is required for certain procedures, and they'll determine what documentation they're going to need for that claim. They will set the fees and rates and issue prior approvals for certain things. Now, keep in mind that some prior approvals are also generated through other agencies, one of them being Magellan, so you'll have information about that. If there's ever a situation that a claim is over 2 years old, that would be reviewed by the Department of Health, and we'll talk about timely submission of Medicaid claims. Initial enrollment into the Medicaid program does go through the Department of Health. And if you need to contact the Department of Health, you can find information there on the right-hand side of your screen. You can reach them at health.ny.gov. And if you have questions about prior approvals or the general Department of Health, you can reach them at 800-342-3005. Again, this is to the general Department of Health prior approval unit. Remember that pharmacy prior approvals occur elsewhere through Magellan. You'll be contacting them. If you have a policy question, you can contact the General Department of Health at 518-473-2160. Now, the reason why I was saying the General Department of Health is because there is a pharmacy program unit at the Department of Health. So now your contact information will be different for the pharmacy side of things. They oversee the pharmacy policy and the drug utilization review program, provider enrollment they help with, prior approval criteria and development. So when you have a question about what is needed for a prior approval, they may be able to assist you with that, as well as Magellan. Required claim documentation for pharmacy side of things, and the reimbursement, pharmacy reimbursement amounts. If you need to contact the pharmacy unit at the Department of Health, you can find their number at 518-486-3209. You can also reach out to them via email at nyrx@health.ny.gov. or refer to their website, as you can see on the bottom of your screen. The Office of the Medicaid Inspector General, or often referred to as OMIG, their responsibility is surveillance and monitoring of fraud and abuse. They also oversee the Medicaid Restricted Recipient Program. They determine if somebody will qualify for that program, and they monitor that program and those patients. These are patients that are restricted to certain providers or pharmacies because there has been, they have been flagged for abuse, possibly of the program, so they are being monitored. If you need to contact OMIG, you can find them at their website, omig.ny.gov, or you can reach out to them at 877-87-FRAUD. If you need to contact them because of the Restricted Recipient Program, you can reach out to them at 518-474-6866, or their email address, I should say, omig.sm.rrp@omig.ny.gov. GDIT is the company that I work for, and we represent eMedNy. Our responsibility is processing your Medicaid claim. So we are the Medicaid fiscal agent. So when you have a question about your claim, you will be contacting eMedNy, or if you have a question about your remittance statement or your funds, your electronic funds transfer or checks, you will be contacting eMedNy. So when you have questions about your bills, your claims, you would contact us. We offer provider training just like we're doing today. However, we do not train on NCPDP software. You will need to contact your software company for that. We can issue paper claim forms. The only ones we do not issue are the institutional UB04s. You will apply for an electronic transmitter identification number, and that is basically a 3- or 4-digit code assigned to you so that it goes on your claims in the background. And if you're going through a clearinghouse, you may be linking up to that clearinghouse's ETIN, and that allows you to send claims to us. It lets us know who we're talking to, and it gives us instructions on how we're going to respond to you. Now you'll hear also another tool or another website called ePaces. Some of you may be using that. Some of you may have heard of that. ePaces stands for the Electronic Provider Assisted Claim Entry System. That is a website where providers can manually enter professional, institutional, or dental claims. ePaces is not available for pharmacy NCPDP claims. You will have to still use your software for that. When you have certain transactions for enrollment, such as maintenance, we will process some of those as well for the Department of Health. We also oversee and maintain the eligibility verification system. So we provide the system for checking eligibility to you. However, we do not update that system, and we'll talk about who does in just a minute. The Drug Utilization Review Program, we provide the mechanism for checking that, and the Dispensing Validation System, which is a system-generated prior approval, often referred to as a DVS. That is a prior approval generated by the system. If you need to contact eMedNy Provider Services in relation to your claims or financial questions, you can contact us at 800-343-9000. We do have a pharmacy unit at that call center to assist you with your pharmacy claims. If you need to check eligibility for a client using a phone system, you can do that. It's called the Automated Audio Response Unit, ARU, and that phone number is 800-997-1111. Now remember that a Medicaid ID number has letters in it. You will need to translate those letters into numbers not specifically related to your keypad. Those letters may have different numbers. So there is instructions on how to use that ARU system found on emedny.org. So that is our website, emedny.org. That is your website where you're going to find some of that information. The local Department of Social Services, or for those of you that are located in New York City, you would be referred to as the Human Resource Administration, or HRA. Their responsibility is still to enroll Medicaid patients into the Medicaid program. So they are assigning eligibility. They are one way of patients receiving eligibility. They will process those patients that have recipient excess income, or what we refer to as a spend down patient. They can issue temporary ID cards. So if a patient loses their ID card, they can go to the local county office and they will issue a temporary ID card. Some prior approvals and authorizations still occur at the Department of Social Services, and if you have concerns about managed care plans, if you're working with a managed care plan and you need assistance with them, you may be able to also contact the county office and speak to a managed care coordinator. There is a listing of all the all of the county offices on emedny.org under your provider manual. The very first section of your provider manual has an inquiry section, and that gives you a listing of all the county offices. Another way for patients to receive Medicaid eligibility is through the New York State Health Benefit Exchange, referred to also as the Health Plan Marketplace. You'll hear commercials online or on TV about the New York State of Health. That is the same website. This is where patients can enroll in Medicaid and receive eligibility, and it is identified as a code H78. So if you're checking eligibility and you look at an office field, that office field would return to you an H78, and that identifies that that patient did not go through the county, but instead they went through the health exchange to receive their Medicaid. If they went through the exchange, that patient will need to contact them in order to have any of their benefits changed or updated. And that number is 855-355-5777. Or you can get to them through their website, newyorkstateofhealth.ny.gov. Magellan Medicaid Administration is the program you're going to be working with. They administer the Medicaid Pharmacy Prior Authorization Program. So when you have a question about clinical prior authorizations, you can contact them. They are available 24 hours a day, 7 days a week at 877-309-9493. Their website is newyork.fhsc.com. You can also, on that website, receive information about those other programs I was referring to, like the Preferred Drug Program. So you can get to information about that through their website as well. The managed care plans are still going to be around. Remember, I mentioned earlier that the transition is not occurring for the managed long-term care plans and the essential plans and the Child Health Plus plans. So again, their responsibility is to contract with you and determine what services are going to be covered. They again also help to educate the recipients, make sure that they are using a doctor's office versus an emergency room. So they still have some responsibility within the program. There is also, again, another listing of all the managed care plans across New York State available in your provider manual. And I'll show you where your provider manual is. In that provider manual, the very first section is information for all providers, And inside that section, there is a managed care section. That also will refer you to their plan code and what type of plan that is. So when you're checking eligibility, you can refer to that, and that will help you in determining, is this a mainstream plan or is it a managed long-term care plan? That will help you in determining, where am I sending my claim to? So some of your responsibilities as a New York Medicaid provider, obviously, first and foremost, you're going to check their eligibility through our Medicaid eligibility verification system. You want to make sure that that person has Medicaid and what form of Medicaid that patient has. Do they have other insurances that you have to bill first? You also want to make sure that you're submitting your claims in a timely manner. Now, we know, obviously, most pharmacy claims happen in real time, and you'll be getting real-time responses. So most of your claims are going to be submitted in a timely manner. But you also need to make sure that you're seeking any authorizations or approvals when they're needed for certain drugs or procedures. Make sure you retain medical record data and you follow all HIPAA guidelines, and that you enroll in Medicaid in order to bill the Medicaid program for fee-for-service Medicaid patients. Make sure you follow all rules and regulations outlined in your provider manual or on the Department of Health websites, and that you're reviewing the Medicaid Update newsletter. I'll show you an example of that newsletter, and that newsletter is available on emedney.org. And then make sure that you refer to our website for any changes of information as time goes on. So here is the emedney.org website. This is a short representation of that. You're going to find a lot of information on this website. The Medicaid Update newsletter that I just mentioned, it is available here on these tools or these links going down the right-hand side. It is at the bottom of those links, you'll find the Medicaid Update. On this website, you're going to find two ways of getting to further information about the pharmacy transition. You can either click on the banner in the middle here, or we have added a link on the right-hand side, and both of those will bring you to the transition page. This is that transition page that we have created. You'll find a lot of information out here. You'll also have links to the New York State Department of Health website over on the right-hand side. Sometimes people ask us for copies of these slides. There is a link here at the bottom, and that is where you'll find this training presentation that you're sitting through and going through right now. That is available here on these useful links. Also, you can find links to the special editions, the Medicaid Update special editions that the state has put together related to this pharmacy transition. There are 3 of those so far, and the latest one is March of this year. They have put out special editions related to this transition, and you can find links to those here on this website. So this could be your first starting point for finding resources related to this transition. Your provider manual is also available on emedney.org. So you'll find the 4th tab going across the top will bring you to your provider manual, and the manuals are alphabetized, so you'll want to look for the pharmacy manual. And this is an example of that pharmacy manual. Now, when there's an update to the manual, we'll post that here on the website. So you want to be referring to the manual at different times. You'll notice that information for all providers that I mentioned to you earlier, in that section, there is one for inquiry, and that is a listing of all the county offices. Also, there's a managed care section in there, and that's a listing of all the managed care plans, their plan code, and their plan type. So it will tell you that that plan and that plan code is either a mainstream plan or it's a long-term care plan. Or is it a heart plan? Is it a SNP plan? So that will help you in determining that that plan has been carved out of, or pharmacy has been carved out of that type of plan, so you're going to bill Medicaid directly. That can assist you with this transition. You're also going to find a lot of other sections here that you'll want to refer to, but I want to point you to first, over on the right-hand side, there is a pharmacy provider communications link. That's a resource or a repository of communications or announcements that have been sent out to pharmacies, so you can get caught up to those communications that have been sent out. Also, we want to point you to a relatively newer section that has been added to the pharmacy manual, and this is in regards to medical supply codes. So this site here, or this page, has been broken down to those specific codes that are also being transitioned out of managed care related to medical supplies. So you can see there's information about enteral formula, medical and surgical supplies, hearing aid batteries, and using pharmacists as immunizers. So information about vaccines that you may be dispensing at the pharmacy. This is a representation of the New York State Department of Health page related to this transition. So this link to the Department of Health is also available on that transition page under the useful links that I showed you a minute ago. You can find additional information here. You can see that there's a link on the left that says information for providers, and that will bring you to a lot of information regarding the other programs that I mentioned earlier, the preferred drug programs, the vaccines, the enteral, the preferred diabetic supplies. You can find a lot of that information also available on their website. So there is a lot of information available to you online. We're going to talk about eligibility and how to check eligibility for a New York Medicaid patient. So we have, believe it or not, a specific provider manual just for eligibility, and you can get to that through the drop-down menu under the Provider Manuals tab. If you click on that third option in the drop-down menu, that will bring you to this page, and you'll find on the left-hand side a link to the MEVS DBS Provider Manual. Now, the most important section in that manual that I would tell you is section 4.1. Section 4.1 of that manual gives you the different benefit descriptions that you're going to see when you're checking eligibility. So what I'm referring to are those benefit descriptions such as MA eligible or eligible PCP, outpatient care only, family planning only, so those different types of benefit descriptions are identified, and it tells you what that person can have when it comes to Medicaid. So that is one resource when it comes to eligibility. When a patient comes to your pharmacy, they're going to present, hopefully, a card to you. Now, some of you may be, if you've been dealing with Medicaid for a very long time, you may be familiar with the old benefit card, but you may still see that out there. There is a possibility somebody still is using that old benefit card. The current benefit card, or the new one, is the one in the middle. These are the Medicaid cards. These are the Common Benefit Identification Card, or CBIC. And on there, you'll find their Medicaid member ID number. That is the number you're going to use to check their eligibility or bill your claim to Medicaid. Now, there may be times that somebody gives you their managed care card. And many of the managed care cards also have or should have their Medicaid number. It will be listed as a CIN number, a CIN, Client Identification Number. And that should also have their Medicaid number on there that you can use to bill if you find that that pharmacy benefit has been carved out of that specific plan. So that's where you're going to find their Medicaid ID number. Also, somebody could be issued, as I mentioned earlier, a temporary card. Maybe through the county office, they've issued a temporary card because that person has lost their benefit card. We also want to remind you that just because somebody has a Medicaid benefit card does not specifically mean they have Medicaid. They may be using that card for other social programs. Maybe they have food stamps, but they don't have Medicaid. It's a possibility, may not happen very often, but we always encourage you, you still should check eligibility to make sure that they have Medicaid. Also, with that, you don't know what form of Medicaid that patient has. They may only have family planning only. They may not have all benefits. So that's, again, another reason why you should always check eligibility before processing a prescription or claim through the system. One of the last forms of identification is the temporary Medicaid authorization form. That would have a specific form number with it, a DSS 2831A. If you receive this form from a patient, it's because they needed services immediately. They are in progress. They are in the process of receiving Medicaid, but they needed services immediately. What you should do is make a copy of that form and give them that copy, their original, give them the form back. But that is basically, I would say, a promissory note that they are receiving Medicaid, but they may not just be in the system as of yet. So that is somebody you want to monitor to see when they get in the system so you can go ahead and process them. Now, again, to check eligibility for Medicaid, there are a few different ways. I mentioned earlier the Audio Response Unit, or ARU. That's a touch-tone telephone phone number method where you can contact us through this phone number. It's an automated response. You'll plug in numbers into the phone system, and it will read to you their eligibility. You want to make sure that you read through, or I should say, listen to the entire message, because there may be things towards the end of the message that you need to know about. Some providers also sign up for ePaces. That's another way of checking eligibility. It's a free internet-based application, free internet website. To sign up for ePaces, you would contact our call center and apply for an ePaces account. You will need your NPI number and an ETIN to do so. But many providers use this as a way of checking eligibility. Now, many of you have a software. Many of you have a software running NCPDP, and you can also submit real-time E1 eligibility inquiry transactions through that, and we will send you a response. If you need assistance with how to use your software, we have transaction instructions online through the companion guides. Now, these companion guides are companions that go with the standard internet, nationwide guides that the software companies are using to write that software. So again, also, if you need help with your software, you're going to want to contact that software company. So just as an important reminder, eligibility verification is necessary to avoid risk of receiving no payment. So you need to check eligibility first and foremost. What we're going to return back to you is we're going to let you know if that person is restricted to certain providers. Do they have any certain exception codes? Sometimes these exception codes help clarify their eligibility a little bit more. They may identify certain programs that that patient is enrolled in. Are they exempt from certain copays? So that sort of thing. Do they have copay information? So some people are not required to pay a copay. Other patients are required to pay a copay. And there are pharmacy copays I'll show you in just a minute. Do they have any patient liability? And usually what we're referring to there is what we call a NAMI, for example, a net adjusted monthly income that would be paid to a nursing home or hospital. So that is something that wouldn't really affect you as a pharmacy. And did they enroll through the county or through the New York State of Health? Remember, if you see an H78 returned under the office field on an eligibility response, that means that that patient went through the health exchange, and they're the ones that are going to make changes to the eligibility. Otherwise, it may be through the county office or the HRA in New York City. Then also, you're going to identify, is that patient Medicaid or straight Medicaid, what we often refer to as fee-for-service, or are they enrolled in a managed care? And so again, with pharmacy coming out of managed care, it's important to determine what managed care plan that is. And is it a plan that has had the pharmacy taken out? And do they have any other insurance? So do they also have Medicare or third-party insurance? Medicaid pharmacy copayments. As I mentioned, there are some pharmacy copayments, and these would be returned on the eligibility response. So you'll see this. You don't have to try and write all this down, but you will see this on the eligibility response, or should. You'll be notified that they have a $3 copay for non-preferred brand name drugs. They may have a $1 copay for generic preferred brand name drugs and brand drugs included in the brand less than generic program. Or do they have a $1 copay for medical sickroom supplies? They may have a 50-cent copay for non-prescription over-the-counter drugs. So just keep that in mind. Now, they have changed the copay program, and it will be based on a $50 quarterly copay maximum. So what do we mean is every quarter of the year, so from January to March, that person will have a maximum of $50. Once they meet that $50, they will no longer have to pay a copay for that quarter. Now, the next quarter, when it comes to April, May, June, that $50 will start over again. So again, it's going to be a $50 quarterly copay maximum. So you still need to provide services even if they are not able to pay. Even if they are not able to pay that copay, you still need to provide services to that patient because they are in Medicaid. So our next thing is we're going to talk about claims, how to submit claims to Medicaid. Now, there are going to be some differences here. You're going to be dealing with medical supplies as well, and some of those medical supplies can or will be billed as a professional claim versus through NCPDP. Many of those procedure codes for medical supplies have also been added to the NCPDP program, so you may also still be able to bill many of those through your pharmacy software. So you'll have to identify those things that will go through your software. Okay, so as a reminder, Medicaid is the payer of last resort. So if somebody has other insurance, you must exhaust all other insurances prior to Medicaid. Now, if you are billing Medicare Part D, Medicare prescription, you will not be billing past that. So I believe you're going to bill Medicare D, and that would be it. But there are other times that you would bill other insurances like Medicare Part B when somebody is buying medical supplies. Okay, some of those may be billed to Medicare B, and then the balance would be passed on to Medicaid. Medicaid processes claims on a weekly cycle. So obviously your claims will be billed in real time, but normally any other providers, we would advise them that if you get your claims in by Monday at 6 p.m., you would be included in that weekly cycle. The cycle does go up to Wednesday, so there is a possibility you process your claims Tuesday and Wednesday. You're probably also going to be included in that cycle since you are on real time when it comes to NCPDP. Your check and your remit would be prepared the following Monday. All Medicaid checks and paper remits are mailed 2 weeks and 2 days later from that check date. So there is about a 2 to 3 week lag from the time that your claim is processed and you receive the financial payment for those claims. Electronic funds transfer will occur on that same release date. It's just that it won't be mailed, it will be transferred directly to your bank. So those funds are available, again, 2 weeks and 2 days from that check date. Those funds are sent to the bank. Please remember that some banks have a 24-hour period or turnaround for electronic deposits. To submit claims to Medicaid, you're going to submit either on paper. Yes, we do still accept paper claims, but obviously most people are going to submit electronically. So you have to make sure you have HIPAA compliant software. Now, the majority of you submitting pharmacy claims are going to be submitting NCPDP format. As I mentioned, there is a possibility of submitting 837 professional claims for your medical supplies. Some medical supplies may go through professional format. Of course, all of your pharmacy drugs are going to go through NCPDP. To submit your claims in either of those formats and you have software, you can submit those claims through the exchange. This is a website that we provide as part of the ePaces sign-up. There's another website that can handle data files. So the exchange handles data files from software. Also, some providers sign up for SOAP, or Simple Object Access Protocol. It's another internet mechanism for sending claims or data files. You'll want to talk to your IT person with regards to that. Now, some of you may be submitting your claims through your software to a clearinghouse, and that clearinghouse would set up one of those mechanisms with us to submit all of those claims. Now, if a provider is using ePaces, again, this would be for your DME or medical supplies only. So we do want to reiterate to you that ePaces does not support NCPDP format. So you cannot submit an NCPDP claim on ePaces. It's only for professional, dental, or institutional. So again, just as a refresher, if you are submitting DME medical supplies, you can submit those on a EMEDNI 150003 form. That's the current iteration. It is a modified HCFA form. So we do not accept, with Medicaid, we do not accept a typical HCFA 1500. You can order EMEDNI forms, you can order Medicaid forms from our call center, and we will send them out to you free of charge. Or you can submit an electronic HIPAA claim on a professional format. Now, as I mentioned, some medical supplies, or many of the medical supplies, can also go through the pharmacy system. But if you had to submit a paper form, that again, you can order from our call center. That is an EMEDNI 301 form. Or you can submit an electronic claim through NCPDP. This is an example of that pharmacy claim form, just so that you know what it looks like. And there are instructions on how to fill this form out in your provider manual. So you'll want to refer to your billing guidelines in your provider manual. This is an example of the EMEDNI 150003 form. So this again is available from our EMEDNI call center. You can order these forms from them and we will send them out free of charge. And again, instructions for either of these forms are available through the provider manuals. In order to submit an electronic claim to Medicaid, your pharmacy would have to establish what we call an ETIN, an electronic transmitter identification number. Now, for those of you that may be in a large chain pharmacy, your billing office, they may have already done this. They may have already done this and you just process the claim through your software. So you may want to check with them. You may already be all set up with what you need. There is a certification statement that would be filled out, and it would have to be updated annually in order to maintain that ETIN. Again, that ETIN comes to us in the background on your claim, and it lets us know who we're talking to, but it also gives us instructions on how we're going to respond to that provider. And what I mean by as a response in regards to your remittance statement. Are we going to send you an electronic remit, or are we going to send you a PDF remit based on how you set that up with us through the request form? The BIN number, sometimes the question from pharmacies is, what is the BIN number? Is that changing? It is not changing. That is the BIN number that has been for Medicaid fee-for-service. That number will still remain the same even with the transition. So that BIN number is 004740. If you are using your software, obviously you may need a user ID and password with your software. If you're going to use ePaces to submit your DME medical supplies through professional format, and you want to use ePaces for that, you're going to need to establish a user ID and password with our call center. So some of this information is available on emedney.org under the enrollment pages. When you're submitting a claim to Medicaid, you're obviously going to submit an original claim. Now, there may be times that a replacement or adjustment would be done, or a void. Obviously, a void is you're asking us to take the money back and do away with the claim. A replacement or an adjustment means that there needs to be a change made to a paid claim. So I'm going to stress to you that a replacement or adjustment and a void can only be done against a paid claim. If you submit an original to Medicaid and that original was denied, you're going to submit again another original. So you're always submitting an original claim until the claim actually pays. Claim status. If you're submitting through NCPDP, your claims are processed in real time. You will be receiving an automatic response letting you know whether that claim was rejected or denied, or if it was paid. So you'll get a very fast response from us through your software for the pharmacy drugs that you're submitting through NCPDP. Now again, if you're choosing to submit your medical supplies or DME products through a professional format on ePaces or through professional software, you will be notified of a paid, denied, or pended status through either an 835 file, that is in a remittance statement, or if you're using professional, ePaces professional real-time, so you do have the ability of submitting a professional real-time claim on ePaces, you would receive a response immediately on there. With those responses, you're going to get codes back, and we do have a tool on emedney.org called the Edit Error Knowledge Base, called the EEKB, to assist you in interpreting those codes that you may be getting back on the response screen on ePaces. Again, you're hearing the term ePaces, and again, that's used for professional claims. So if you're using ePaces to submit your DME medical supplies that are being carved out, you can use ePaces to submit claims for those. All your other pharmacy drugs, Those are going to go through your software on NCPDP format. Continuing with that 837 professional or ePaces, you'll also be notified if a claim is being rejected. And on ePaces, you would receive rejection codes. If you're using professional software to submit a professional claim for your medical supplies, you would get back a 277CA file or claim acknowledgement file, letting you know whether your claim was accepted into the system. So this is what we call pre-adjudication. You would get pre-adjudication edits for those claims being rejected. We do have a crosswalk available online to interpret the rejection codes that you may receive. It is important to look at this rejection or any rejection because rejected claims do not appear on a final remittance advice. Now, your final remittance advice can be sent to you in different formats. Automatically, you would receive paper if you haven't signed up for an electronic version. We have two different electronic versions. A PDF of a paper remit is an electronic version sent to you electronically, or you can sign up to receive an electronic 835 file, and that would need software for interpretation. A PDF remit can only be sent through the exchange, and that you would need an ePaces account in order to have access to the exchange. Electronic payment and responses. So obviously we are encouraging providers to sign up for electronic funds transfer, meaning we will directly deposit into your savings or checking accounts at your bank. Again, many of you in large pharmacies, maybe your billing office has already done all this with us and set all that up prior. And as I mentioned, there are two ways of receiving your remittance statement, either through HIPAA compliant 835 formats or through a PDF remittance that looks exactly like a paper remit, but that would be delivered to you electronically through the exchange. So the exchange, again, you would need access to ePaces in order to activate that exchange website. So we are encouraging all providers to do as much electronically as they can. This is just a sample or an example of what a paper or PDF remittance advice would look like. Like I said, this is your final statement coming from Medicaid, letting you know whether claims were denied or paid, or even pended. You may see some on there as pended. Again, this will give you information about the claim, the client ID, their name, date of service, and your claim number. So remember, if you're ever calling our call center regarding the payment of a claim or the denial of a claim, they're going to need this TCN number, this transaction control number, or sometimes it's referred to as a payer claim control number. This number is what they're going to need from you in order to look your claim up and assist you with why that claim is denying. On that remittance statement, and if I go back to that, you'll notice there are error codes. These error codes can be interpreted on a tool that we have on eMedNI.org. Under the eMedNI HIPAA support tab, remember HIPAA oversees the electronic communication of claims back and forth, and sometimes some of you will receive electronic identification codes, but on that remittance I just showed you, there are other codes. So those codes can be interpreted on this tool, the Edit Error Knowledge Base. And again, this is a reminder that this is for those claims that you may be submitting through a professional format. So if you're submitting DME or medical supplies on a professional claim, Rather than through your NCPDP software, you're going to get back different codes. On that tool, if you're receiving a paper or PDF remit, those edit codes or error codes I showed you would be inputted in box number 1. If you're receiving an electronic response through a software, that software and those electronic responses would have to follow the HIPAA Act. So you would receive back HIPAA codes. So anytime you see HIPAA, we're really referring to electronic communications. And on a remittance statement that's sent to you electronically on a software, then you would use box number 2, possibly the left-hand side. If you're looking at ePaces and you're using ePaces to submit your DME or medical supplies on a professional format, and you're looking at a response screen on ePaces, you're going to use the right-hand side of box 2, because what you're getting back on ePaces is a healthcare claim status code. So you would use the right-hand side of box 2. So this is a tool that many providers outside of pharmacy use to help them in interpreting the response they're receiving on their claim. We also have, as I mentioned, pre-adjudication. So we look at claims quickly before we even allow the claim through the front door, and that's called the pre-adjudication. So we can reject a claim, and again, we have a crosswalk to help with that. So again, you go to eMedi HIPAA support and you go to crosswalks, and on there is a document called the Medicaid pre-adjudication crosswalk, and that would return to you codes. So again, just as a reminder, this would be related to your professional claim if you're using that to submit DME or medical supplies. This is an example of that crosswalk, and these are examples of codes that we returned to let you know if a claim sent professionally was rejected. As you can see on this document, this is for institutional, professional, or dental. So this does not cover NCPDP. And we're going to talk about that in just a second. So in your pharmacy provider manual, we have something called the ProDura or ECCA manual. And that is in your pharmacy provider manual. Down at the bottom, there is your ProDura ECCA provider manual. Going into that section, you're going to get that manual, but that is to assist you with your claims you sent through your pharmacy software. So if you're sending claims through NCPDP, you're going to get different codes back. So whether a claim was denied, pended, or rejected, you're going to get codes back. And this manual will help you with those codes or those code lists. So again, that will bring you to this page where you can click on and open up that PDF manual. Okay, so again, this is in relation to NCPDP format. So on that manual, you'll notice there's a section for prescription denial codes. There's also a section for penned reason codes and NCPDP reject codes. Many of you may be familiar with this already, but if you're not as familiar with sending claims directly to Medicaid through your NCPDP software, you may be getting codes back. This document will help you in interpreting those codes and figuring out why something was being rejected based on the codes you're getting back. We also want to quickly go over timely submission. Now again, many of you are not going to bump into this. You're submitting your NCPDP claims in real time, usually right there as you're processing the prescription, you're submitting your claim, so your claims are going to be within the time frame. but this can apply also to your professional claims. So you want to make sure that your claims are submitted to Medicaid within 90 days of the date of service. So basically 3 months, but it is based on the calendar days. So remember, some months have 28, some months have 30, 31. So again, we're counting 90 days back from today. Any claims within that time period do not have to have a delay reason. Any claims over 90 days from today would have to have a delay reason code associated with them. Those delay reason codes, many of them have a 30-day time frame within them. So once that time came back to your control, you then have 30 days to get that in. A couple of those delay reasons, like if you needed to correct a denied or rejected claim, or you're correcting or resubmitting a paid claim, like an adjustment, then you have a 60-day time frame for some of those delay reasons. So in most cases, an adjustment is better to do rather than avoid and rebill, because that rebill is now going to bump into the 90 days a lot harder. So it is better in most cases to try and do an adjustment if you're able to. So again, just as a reminder, and this is part of the policy that's in your manual, all of this is in your manual. Claims not correctly resubmitted within 60 days, or those continuing to not be payable after the second resubmission, are neither valid nor enforceable. So as I mentioned, there is a 90-day delay reason. We're going to go through this a little bit quicker, but there is a paper form that would be needed if you're submitting on paper. So if there was a case that you had to submit a paper claim form professionally, or maybe even pharmacy-wise, there is a delay form that goes with that paper claim. So that form is available on emedi.org, and we can always direct you to that if you don't have it later on. You can always contact the call center and they can direct you to where that form is. You're going to submit one form with one claim form. So if you have multiple claim forms you're submitting on paper, then each of those is late, each of those is over 90 days, then you need a separate delay form for each one. An example of that delay form is found here. This is I apologize for the squishiness of it, in order to try and fit that entire form on the slide, but this is what that delay form is going to look like. You would choose the reason why your claim is late. So we get a little bit more limiting, or you're going to get a lot more limiting, shall I say, with the reason why a claim might be late to Medicaid. But like I said, most of you are not going to encounter this since you're billing in real-time NCPDP format. So this would probably more so apply if you're having delays with your professional medical supply side of things. This is an example of the electronic delay reasons. So this is what you would see on electronic software. All of these delay reasons can be submitted electronically, though for professional claims for your DME medical supplies, if you're choosing number 11, that claim does have to go on paper if you're submitting a professional format. So again, most of these delay reasons can go electronically. It is up to you as a provider to choose the appropriate reason for the lateness of your claim. Any claim that's over 2 years old, and again, this is going to be a very rare occurrence, but we do want to just cover this with you. These instructions are all found in your provider manual, and the call center can direct you to those. But you would have to submit that claim to us. We would deny it for over 2 years. You would drop it to paper. You would send us a copy of a remittance, a written request, and any supporting documentation showing that the claim was an error of the state, the county office, or any state agency or court order of why your claim is over 2 years old. And you would send it to a specific address for processing. So again, these instructions are in your provider manual. Medicare crossovers. Now these Medicare crossovers occur for Medicare Parts A and B. Medicare Advantage plans do not cross over to Medicaid. And these are again for your professional DME or medical supply claims. So remember, your DME or medical supply claims may have to be billed to Medicare Part B first, and they may very well cross that claim over to Medicaid for you. Now remember that this is a courtesy. You do still have to check those claims. You need to make sure that the crossover occurred and that the crossover occurred correctly. So you still have to double check those claims and make sure that they processed as they should have. Medicaid or Medicare will notify you on their statement that they crossed the claim over to Medicaid. And then Medicaid will respond to you through our remittance to let you know that that claim was paid or denied. So you need to make sure that you're keeping up to date with those statements to make sure that that crossover actually occurred. If it didn't, you need to turn around and get your claim into Medicaid as quickly as possible. Authorizations. There are some procedures that require authorizations. Now, any procedure, any HCPCS or CPT, or sometimes some of your pharmacy items require a prior authorization or prior approval. That would be any procedure code that is underlined in the procedure code section of your manual. Now remember that you have Magellan. Prescription drug prior authorizations occur through Magellan, so refer to them with regards to what procedures are going to need prior authorizations. Some procedures also require what we call a DBS, and that stands for the Dispensing Validation System. Some procedures would have what we call a number sign or pound sign, hashtag, whatever people are calling it, after the procedure code in the procedure code manual. It would also sometimes indicate DBS required. This DBS system is only available on ePaces. So you would have to have an ePaces account and obtain that DBS through there. Now, sometimes you may have the ability of getting authorizations through your software. So some authorizations occur automatically through your software, and they may be talking to Magellan or to other systems. So make sure that you figure out with your billing agency, with your billing department at your pharmacy on how things are happening when it comes to authorizations. And make sure you review with your provider manual those things that are going to need authorizations. Enteral formula is something that does need authorization, but we want to go over some of these different medical supplies that you're going to be taking on and billing to Medicaid directly. So further information about enteral formula can be found in your pharmacy procedure code section. Remember that medical supplies section I showed you? There is a section in there regarding enteral formula. Just as a reminder, this benefit is limited to 2,000 calories per day for those that are tube fed or have inborn metabolic disorders, children up to 21 years of age who require liquid oral nutritional therapy when their nutrients from food cannot be absorbed, or orally fed adults with a diagnosis of HIV infection, AIDS, HIV-related illnesses, or other diseases or conditions. Enteral formula will also need an authorization. So these would be any codes that have an asterisk or a star after them in your procedure code section of your manual. We have had, or the state has had, recent trainings on enteral formula because they have a new enteral web portal. So there is a process that has to occur when an authorization is sought for enteral formulas. The prescriber has to initiate that authorization. Now, they can initiate that authorization through an interactive voice response system or now through the web portal. So there are worksheets to assist with the prescribers and you as the dispenser. You then will finish out, or you will activate that prior authorization through the IVR system, either again through the phone system or the new web portal. This is an example for you of the dispenser worksheet. This is available to you through the DME provider manual. You may also be able to get to it through your pharmacy manual. But there is a link in your policy section or in the enteral formula section that takes you to the worksheet. So this is helpful to fill out ahead of time so that when you're either on the IVR calling system or even on the web portal, you've got all the information that you're going to need in front of you. But again, as a dispenser, you're going to activate the prior authorization that the prescriber has already initiated. So that's a two-step process for enteral formula. You'll enter in your prompts and the responses on your keypad if you're using the phone system, or your pharmacy may want to sign up for the web portal. Now remember that there is one web portal account per NPI number. So you'll need to coordinate that with your pharmacy, who's going to sign up for that portal if you're going to use that mechanism. And you can use either of the mechanisms. You can either use the IVR phone system or you can use the portal or both. Vaccines. Vaccines can be obtained for Medicaid members 18 years of age and older. So here's a list of vaccines that can be dispensed to a patient. Reimbursement is provided to Medicaid enrolled pharmacies for vaccines and anaphylaxis agents administered by certain pharmacists, or I should say certified pharmacists, or a certified pharmacy intern under that supervision of the certified pharmacist. So again, information about vaccines can be found on the New York State Department of Health's website for pharmacy. That website I showed you earlier, under the information for providers, there is a section for pharmacists as immunizers. Also, you can find information, all the procedure codes available to you through your provider manual. Billing a vaccine, you're going to bill the administration fee and, when applicable, the acquisition cost of the vaccine using the appropriate procedure codes. So this information is also available on the Department of Health website. You'll find your claim segment fields, 436E1, you're going to enter in a value of 09, but you're putting in a procedure code. So 407D7, you would enter in the applicable procedure code. And again, up to 4 claim lines can be submitted with one transaction. So this information, again, was taken right from that New York State Department of Health website, where they had information about pharmacists as immunizers. That's what you're looking for, pharmacists as immunizers. And again, just as a reminder, you're not using NDC codes for billing the vaccine product to Medicaid. Diabetic supplies. As I mentioned, there is the Preferred Diabetic Supply Program, and that is to provide access to quality glucose meters and test strips while also reducing overall program costs. So voice-synthesized blood glucose monitors, talking monitors, and disposable blood glucose monitors are excluded from the program. These products continue to be covered by Medicaid through the existing DME dispensing validation system, PA process. Coverage information of real-time continuous glucose monitors can be found in the January 2022 Medicaid update. So remember, you may want to review that Medicaid update for information about real-time continuous glucose monitors. If you have questions about the Preferred Diabetic Supply Program, you can contact it at 518-486-3209. And a list of those products, again, you can find information and a list of products available through the Magellan website. They have links on the Magellan website to the Preferred Diabetic Supply Program. Dual eligible beneficiaries, when you're billing for Medicare beneficiaries, NDCs should be used and in fact are required when Medicare has approved 0. Reimbursement for preferred products cannot exceed the lower of the usual and customary charge, nor the fee for each NDC on the list of Medicaid reimbursable drugs. So again, just as effective back in 2017, the quantity limits will be applied based on diagnosis for preferred test strips. So 300 test strips per 30 days for type 1 diabetics. Type 2 diabetics are 100 strips per 30 days. So we only have a little bit more to go here. Keeping up to date with changes of information, as I mentioned to you, this is an example of the Medicaid Update newsletter. Now, this is a newsletter that is normally published once a month by the State Department of Health, and a link to the newsletter can be found on emedney.org. Towards the bottom of the right-hand side, those links on the right-hand side, there is a link to the Medicaid Update newsletter. Now, the state has, as we showed earlier, published special editions related to the pharmacy transition. And here is the most recent special edition that was just published in March of this year, related to the part 3, related to a lot of the DME information you're going to find in this special edition. So you may want to make sure you review that Medicaid update, as well as parts 1 and 2. We also have on emedney.org what we call the list serve. So that is also available on the links on emedney.org. On the right-hand side, right about in the middle, you're going to find a link that says Emedney Listserv. And this is in addition to the newsletter. So these are alerts that we send out to you. And you can sign up specifically for pharmacy alerts or DME. So if you're submitting those medical supplies and that's considered DME products, you can sign up for those alerts also. So these are sent above and beyond the Medicaid Update newsletter. So these are things that we have to get out to you right away, other notices that you might be informed of. So you can sign up for that as well. On our website, we also have what we call the What's New button, or the What's New tab. Basically, this tab is going to tell you what we have added or what we have changed to the website. So you can see, look at the very first one here, says new, as of March 15th. We updated a provider manual, we updated the DME provider manual with regards to the enteral formula prior authorization webinar. So you may want to review that. That may be the link to the previous state webinars that they did regarding the enteral portal, the enteral prior approval portal that's now been created. So you may want to review that. So again, this is a good tab to look at to see what has been changed or updated on the Medney website. We offer training on our website and other features. So we have training on ePaces. So if you're going to sign up for ePaces and submit your medical supplies through ePaces rather than through NCPDP, you can sign up for training on ePaces. So we will offer the training calendar in quarterly increments. So we're getting prepared for April, May, and June at this time. And you can find that calendar just by going to the Provider Outreach and Training tab. Some other tools that are available to you. One of the big ones that I mentioned earlier is ePaces, and this is an example of what ePaces looks like. As I mentioned, it is web-based, so you would have to have access to an internet browser. You would have to sign up for ePaces, so you have to establish a user ID and password with our call center, and they're going to need your NPI number and an ETIN code that you want to associate with that. So they can help you with that. Now, ePaces can be role-based. So you can have multiple people at your pharmacies with accounts. You can use this to check eligibility, to check claim status, to submit your DME claims, your medical supply claims. But I do want to reiterate that ePaces is not available for NCPDP claims. So pharmacy drug claims still have to go through your NCPDP format software. I mentioned briefly the word exchange. The Medney exchange, I mentioned, is a way of sending data files. So if you do have professional software to submit those medical supply claims, that software could talk to the exchange. You'll need to talk to your software company and how you're going to set that up. But if your software can generate a batch of claims for those medical supplies, you could submit those batches of claims through the exchange. It's just another mechanism for sending a data file. Obviously, NCPDP is going to be set up differently, but this would be more so for your professional claims for your medical supplies or DME products that are being transitioned out. If you are submitting claims through the exchange, we will respond to you through the exchange with a status response, a 277 file. You need to make sure that you go and get that file because this exchange only holds the files for 28 days. So you have to make sure you go and get that file and put it back through your software to find out if your claims were accepted or rejected. Some providers also sign up to receive their remittance statement through the exchange. So again, you need to make sure you're getting that remit, that EOB from us, getting it off of there within the 28 days. Now, I mentioned earlier your ProDura and your manual and that sort of thing, but I mentioned earlier the Medney HIPAA support tab with regards to the crosswalk and the edit error knowledge base. Again, those are for professional claims. But you'll also find information about transaction instructions here. So if you have questions related to your software with regards to transactions on your software, this is another way of getting to your ProDura provider manual for your NCPDP transactions. So you'll find a section here, it's highlighted in yellow, that is your D.0 software format. And you can find the provider manuals and companion guides for NCPDP formatting here on the transaction instructions. So we have reached the end of today's webinar. This is just a list of reference and contact information. Again, if you need to, refer to the Medicaid pharmacy list of reimbursable drugs. You can find that through emendi.org. Also, make sure you're reviewing information found through Magellan, through their website. And again, if you have questions related to the transition, we're not going to be able to answer those questions here on today's webinar, but you can contact the Medicaid Pharmacy Program at 518-486-3209 or email them at nyrx@health.ny.gov. So thank you again for attending. We hope you found this helpful. And again, thanks and have a nice afternoon, everybody.